I'll just give it another minute or so just for everyone to join in.
Same nicknames.
Ah, yeah. Cool. Should we? Oh. Okay, let's go for it. We've got some people kind of still joining in. Let's go for it. Oh, where is? Okay. Okay, here we go. Okay, so which of these is not a hard sign of penetrating neck trauma? We've got hemoptysis, hematemesis, neurologic deficit, a non-expanding hematoma, and air bubbling through the wound. Most people going for non-expanding hematoma, which is the correct answer. This is an article from 2021, and it's got a good kind of table of the hard and the soft signs. So one of the soft signs is a non-expanding hematoma. It's a hard sign if it is an expanding or pulsatile hematoma. Question 2. What does this winch hand signal mean? And it's one arm horizontal chopping motion across the body. So keep me at this height, stop all movement, move helicopter in the direction indicated, or disconnect the tagline. And the correct answer is keep me at this height. So the winch hand signals, they can actually be found on the item app for revision under the emergency action cards. And yeah, the one arm horizontal chopping motion is stop winching in and out and keep me at this height. Question 3. So quick clot gauze. So you remove the clot, pack the gauze in the wound, and once packed, apply consistent pressure for how many, or at least how many minutes? And the correct answer is at least 3 minutes. And we've got quite a range of answers there, between 2 and 20. And so that's the back of the quick clot gauze there. Let's see how our leaderboard is going. So vertically challenged is currently winning. Okay, moving on to question 4. Okay, so this ECG is most commonly seen with which condition? Correct answer is hypothermia. So this was a Osborne J wave, which is a positive deflection at the J point, and it's most commonly seen in hypothermia. Question 5. Which of these is not part of the ARDSNet lung protective ventilation? So we've got powder volume of 6 mils per kg using predicted body weight, plateau pressure of less than 35, permissive hypercapnia, and optimal PEEP. So it's a plateau pressure of less than 30 is on the ARDMET lung protective ventilation strategy. And you can have some permissive hypercapnia as long as the pH is greater than 7.2. There's a really good anesthesia tutorial of the week article on this, which is what I used lots of these before. So question 6. According to the Brain Trauma Foundation guidelines, the target systolic blood pressure for a 75-year-old male who's had a TBI is greater than what? And it's 110 millimeters of mercury. And yeah, a few answers there, but kind of, yeah, we've got 110 there as well. So this is the Brain Trauma Foundation guidelines. And yeah, so maintaining for patients above 70 years old, maintaining a systolic blood pressure of greater than 110 millimeters of mercury. Let's look at the leaderboard. Clippy is doing well. Question 7. So according to the Brain Trauma Foundation pediatric severe TBI guidelines, what is the minimum cerebral perfusion pressure we should be targeting in pediatric patients? And the correct answer is 40. So we've got a bit of a range of answers there. So the guidelines from the Brain Trauma Foundation say that a cerebral perfusion target for peds between 40 and 50, with the minimum value being 40, and infants being at the lower end of that range and adolescents being at the upper end of that range. Question 8. During a superficial serratus anterior plane block, what is the target location for the local anesthetic? Is it A, B, or C? And the correct answer is, correct answer is B. So this is the kind of same diagram, just with colored in. So we've got the serratus anterior muscle in the middle, the big one, underneath the lat dorsi, and we want in between, for superficial block, in between the lat dorsi and the serratus anterior. There is a deep block you can do where you go between the serratus anterior and the rib, which has a similar efficacy, but for the superficial we go between the lat dorsi and the serratus anterior. So it gives good analgesia for anterior, anterolateral, and lateral rib fractures, and can also be used as a analgesia for ICC insertion. Again, there's a really good anesthesia tutorial of the week on this block, which is just a few pages long and kind of goes through the technique. Question 9. In the patient with refractory shock, the alpaca cognitive forcing tool can be useful. What does the C stand for in this cognitive aid? And the correct answer is calcium. A few different answers there. So this is from Cliff, the L packet algorithm. And yeah, C stands for calcium, checking your ionized calcium is greater than 1.1 and then replacing it if needed. Let's look at the leaderboard. Flippy is still in the lead. Okay, question 10. In carbon monoxide poisoning, the oxygen saturation reading on a standard pulse oximeter will be so less than 85%, 85 to 90%, or greater than 95%. And the correct answer is greater than 95%. So yeah, standard pulse oximetry cannot screen for carbon monoxide poisoning as it can't differentiate between oxyhemoglobin and carboxyhemoglobin. It's met hemoglobin, which has a saturation between 85 and 90%. Question 11. Coach read protocol for the safe and timely incorporation of focused echo into the rhythm check during CPR. What does the E stand for in Coach read? And the correct answer is echo off or echo away. I'm not sure if anyone got that one. So this is Coach read. And yeah, just kind of a slight change on coached for trying to maximize getting good echo views during the rhythm check. Question 12. In the unconscious patient, the indications for pre-hospital lateral camphotomy and campholysis includes history of blunt craniofacial trauma, proptosis, and relative afferent pupillary defect, or RAPD. Non-reactive people, that could, yeah, sorry, that would be an answer as well. Yeah, so this is from the ACI website. So yeah, suspected orbital compartment syndrome and evidence of retinal dysfunction with an RAPD. Flippy's still in the lead. Last three questions. During newborn life support, the oxygen saturation probe should be placed on the right hand, left hand, right foot, or left foot. Yep, cool. Everyone got that one right. Yep, so we go on the right hand to get the pre-ductal saturations before we get mixing from the PDA. Question 14. The 5 Ds, which is a cognitive forcing strategy for sepsis source control, include something, drainage, debridement, device removal, and don't forget the heart valves. What's the first D? And the correct answer is drugs. So this is from Cliff. Yeah, the 5 Ds, which has come up in Coffee and Cases quite a few times over the last few months. And last question. Which of these options is not a feature of cardiac tamponade on point of care ultrasound? So dilated and non-collapsing IVC, right ventricular systolic collapse, right atrial systolic collapse, and a large pericardial effusion. And the correct answer is right ventricular systolic collapse. You actually get, so it's right ventricular diastolic collapse you get with cardiac tamponade. And you get right atrial systolic collapse as well. Look at the, and that's, yeah, there's a good article on EM Crit regarding that as well. So final leaderboard. Looks like Clippy's taking it. Good job, Clippy 567. Awesome. Thanks very much, guys.